My name's Dr. Graham Frankel from Laser Vision SA, and if you're watching this video, you're probably considering a cataract procedure, but wondering about whether you might need glasses afterwards, and if so, what type, for what tasks or what purposes. So I'd like to explain a little bit about the options that you might have available to you here at Laser Vision SA. So in cataract surgery, we remove the lens from inside your eye that's located behind your pupil, and we replace it with an artificial lens implant. It's usually made of acrylic, and it's maintenance free, it doesn't degrade or reject, and it stays in your eye forever. So you don't need the cataract procedure done again. These lenses are made of acrylic, and they don't change shape to change focus like the original lens did when you were young. If this lens is in focus for distance, then you would need reading glasses. If it's in focus for reading without glasses, then you will need glasses for distance tasks such as driving, watching television, or seeing down the road or across a garden. Some patients, in fact most patients, are very happy to have lens implants that give them great distance vision, and they carry on using reading glasses as they always have for the last 20 or 10 years. But there are some patients who don't do much driving or watching television, and they might do a lot of reading or needlework. Those patients might choose to have both eyes in focus for near work and just occasionally use glasses for their distance tasks. Another group of patients, well, they're very keen to use glasses for everything as little as possible. And there are really two ways we can do this. But both need to consider consecutive surgery with one eye having a cataract procedure 1 week and the other a week later. In the first set of patients, we can do one eye for distance and the second eye for near. Now this sounds a little strange. It's really a modern version of the old-fashioned monocle that Colonel Blimp would have worn screwed into the eye socket. It's a concept that works well because although we have two eyes, we have one brain and one perception of vision. And the brain is very good in 90% of people at blending the vision from both eyes together to give you one view of the world. So you don't need to close one eye or the other or cover them in turn to see what you need to see. But in 1 out of 10 people, the brain doesn't really like the difference, and patients can feel uncomfortable. And then they would need a second procedure to make one eye match the other. So we offer this choice to patients who are really quite motivated to use reading glasses less. Having said that, this is the most common way that people do not use glasses for the majority of distance and near tasks. But let's say you want to use glasses as little as possible for distance and near, but you don't like that sound of having two different eyes, one for distance, one for near. Then we can offer you a multifocal lens implant that gives you both distance and near for each eye. And I would talk to you more about what you can achieve with these. But whether it's with the multifocal lens implant or monovision, I'd like to emphasize that whilst we're reducing how much you use glasses for distance and near, with those types of technologies, we're not unfortunately taking you back to 21, when you probably had perfect vision for all tasks in all environments. We will get you out of reading glasses and distance glasses for 90 or 95% of your tasks, but there are going to be some times when you need glasses. For example, in the distance, that might be for driving at night in the rain, which can be surprisingly visually demanding. Or for near, threading a needle, or reading newspaper or novel cover to cover. If you work on data entry on a computer all day, you might also need glasses for that as well. So these lenses offer what we might call social vision. They allow you to do 90 to 95% of tasks without glasses, such as reading a menu, reading the main parts of a newspaper, a size or a price, seeing faces, food and friends clearly, and driving without glasses. But for really detailed, demanding vision, you may still need glasses from time to time. So that was a brief summary about some of the options available to you in terms of the vision implants that you can have to achieve the vision you want after a cataract procedure here with us at Laser Vision SA. Thank you very much for taking the time to watch this video, and if you have any more questions about any of the things I've discussed here, please feel free to contact us via the contact details on the screen before you. Thank you once again for your attention and interest.